Provided by Wasatch Builders and Repair.
I love trying new skin treatments and then sharing the results with all of you. So when I heard Utah Facial Plastics had a brand new laser, I jumped at the chance to try it. So nurse practitioner Katie joining us now in this sponsored segment to tell all of you what I had done last month. It is called the Halo, and we're going to talk about the results and show you pictures in just a second. But what is the Halo all about, Katie?
The Halo is a very unique laser. So it's the world's first dual laser. So when I'm firing the Halo, what I'm doing is I'm using two different laser wavelengths, and in the same micro channels, I'm delivering both those wavelengths. And so what I'm doing is I'm giving you a more aggressive treatment with less downtime.
So this is you and I a month ago, and first we numbed, and I sat there for a little bit while that numbing gel took effect. And then look, you can see you scraping that off, and then you started. Now talk us through what it feels like and what you're doing to the skin.
So what we're doing, we have to initially numb the skin. This is an aggressive treatment, right? I don't want you to feel all of that. So we get that numbing on, we allow you to numb, and then afterwards I go through, prep the skin. I want to make sure that there's nothing remaining on the skin because I am ablating tissue. I'm creating microchannels and I'm controlling the depth of those. After I have done that, then I actually begin doing the treatment, as you can see here, where I cause that controlled damage almost. And so with this, I can target different issues, concerns that you have.
Let's talk about those. What does this help?
Honestly, this is kind of a magic wand. So you name it, we can pretty much target it. I change my wavelengths of both of the lasers to treat whatever your specific concerns are. The biggest questions I get, I have darker skin types. Guess what? This is safe for all Fitzpatricks. I have melasma. I can't do laser treatment. Yes, you can. This is safe for melasma patients. I can decrease pore size with this. I can do texture. I can do anything that really is a concern. If you come to me in our personal consultation, I will tell you what we can do and we will tailor the treatment to your needs.
And you and I talked about this. I have sun damage. I definitely spent some time out in the sun, so we targeted that. And then I have a lot of lines around my mouth, fine lines. I've never smoked, but they're almost like smoker lines around my lips. And so I said, Katie, can you target that area?
And we said yes.
You said, in fact, I'm going to go really hard on that area.
And that's something that I love to do. When you come in, I want to know what your specific concerns are. In a consultation, I'm not going to sit down with you and say, this is what I want to do for your skin. I need to know what you want for your skin. And based on that, your treatment will be catered to all of your major concerns, and we'll hit those spots that you really worry about.
And we did my neck, and in fact, then we went down on my chest where I have sun damage.
Yes. This laser is safe anywhere on the body, actually.
Really?
The most common places we'll use it: face, neck, chest. Hands are very popular.
We did my hands.
Yes.
How many treatments until you see results?
I would say on this that it's typical that we need 1 to 2 treatments. 2 is more average. But depending on what your concerns are, I will let you know.
So you saw the actual treatment. Can I now show everyone before and afters?
Please do, yes.
Okay, so this is what it looks like after. I sent these pictures in this morning, and I tried to be religious about taking them every single morning. So this is me right before the treatment, makeup on. All right, so you saw the actual treatment. Now this is the first day after, and I did this on a Friday. I did not go to work for a couple days. Did you see around my mouth?
Yes.
Those are scabs, right? Those are
little scabs. We call them MENS. They're microscopic endothelial necrotic debris that's pulling to the surface.
But by the way, I put makeup on those. I wanted to do a close-up so you could really see it. My mouth was tight. It was even hard to talk. But you could put makeup on that within 24 hours?
24 hours, you're safe to start using your mineral makeups and your skincare products and everything. We'll discuss all of that in your consultation.
I sent you some of these pictures. Can you see everything coming to the surface around my cheeks?
I love it.
Too. Is that the sun damage?
That's the sun damage, and that's other necrotic debris that's being pulled to the surface. This laser is going to stimulate collagen. It's going to help with so many different things, even out that skin tone. And all of that is what you're seeing right there.
Can we go to the last picture, because I can't tell you. There we go. Look at that. I think that was day 5. Look at that brand new baby skin around my mouth. I mean, it just got better and better each day. But I want you all to know that all those the scabs are normal.
That's totally normal.
Totally normal. And especially in that spot where you really, if you have an area that you'd like you to go aggressive on, that's where that's going to turn up.
Yes, just remember that I'm causing more damage there. It's controlled damage. It's like aerating lawn. I'm creating holes there, but the goal is that those little channels allow your skin to heal it's going to give you better results in the end.
Katie, I keep getting compliments on my skin, and this is why. If you'd like to schedule a consultation at Utah Facial Plastics with Katie, all their information is on your screen in this sponsored segment, utahfacialplastics.com. They also have a big event. They're showing off their laser coming up the end of September, so make sure you follow them on social media and take a peek at their website for more information. Maybe you just go in and take a look and say, I want what Nisha did. I want to try that. Katie, thank you so much.
Hey, thank you so much.
Am I
I
glowing?
appreciate it. You're
Am I glowing?
glowing. You have the
Thank you.
halo glow.
Up next, frying up Korean corn dogs in the kitchen. It's getting tasty. And take a look at your screen for what's to come up on the rest of the show, including a mentalist live in studio at 9:38.